Ladies, you're washing your vagina completely wrong. And I'll tell you exactly why. There's so much bad advice on the internet, and a lot of it is actually harming women over 60 without them even realizing it. Some of you are using fragrance soaps because you think you should smell a certain way. Others are scrubbing too hard, or even rinsing inside because that's what a magazine or a friend once suggested. And I need you to know, as your doctor, that these habits can actually make things worse, leading to dryness, irritation, or even infections. So today we're going to break through the confusion once and for all. In this video, I will explain how women over 60 should wash the vagina and vulva, and yes, there is an important difference between the two. Because once you understand which part should never be washed and which one needs gentle care, everything will start to make sense. Before we start, let me know in the comments what's your age and where you're watching from, because I'd love to connect with all of you. Every woman deserves clear, honest information about how to wash safely. Because the truth is, so many women have been following routines that are quietly damaging the very area they're trying to protect. You've been told that cleanliness means scrubbing, that odor means shame, and that soap means safety, when in fact those habits are often the reason the discomfort never truly goes away. And here's something I want you to think about before we go further. You might have been doing the exact same thing for decades, thinking it was right. But what if that single habit, the one you repeat every morning in the shower, is the reason irritation keeps coming back? What if feeling clean has been making things worse? I'll explain why that happens, and by the end of this episode, you'll know the truth about what your body actually needs to stay balanced, comfortable, and healthy. Welcome back to the Female Health Podcast, where we talk openly and honestly about women's intimate well-being after 60. I'm Dr. Lia Parker, gynecologist and intimate health psychologist, and for more than 3 decades I've helped women through every stage of life, from the confusion of menopause to the quiet struggles that too many keep to themselves. And before we dive in, I want to share something special. Memberships are now open on this channel. By joining, you'll enjoy exclusive benefits, priority responses to your questions, and access to a private chat where you can ask me anything you'd like. It's a safe, personal space just for us, and I'd love for you to be part of it. Now, today's topic might sound simple, but I promise you it's one of the most misunderstood subjects in women's health. We're going to uncover the myths, the do's and don'ts, and the small changes that can protect you from years of irritation and discomfort. And I need you to stay with me until the very end, because one of the habits we'll discuss, the one that most women never think twice about, is actually the most damaging of all. When you hear it, you'll understand why so many women continue to struggle even when they think they're doing everything right. So let's start from the beginning and clear up the biggest confusion once and for all. Because before you can wash correctly, you first have to know what you're washing. And that's where most women make their first mistake. Let's clear up the biggest confusion right away. Most women, when they say vagina, are actually talking about their vulva. And this is an important difference because it completely changes how you care for yourself. The two may be close together, but they play very different roles, and mixing them up is what leads so many women into painful habits that never needed to happen in the first place. Your vagina is an internal organ. You can't see it from the outside. It's a muscular tube that connects your cervix, the neck of your womb, to the world outside. It's hidden, protected, and designed to take care of itself. In fact, it has its own natural cleaning system. The lining produces secretions, what you know as discharge, and that fluid naturally carries away old cells, bacteria, and even traces of menstrual blood. On top of that, the vagina maintains a very specific acidic environment that protects you from infections. It's an incredible self-regulating design. Now, your vulva is something entirely different. That's the part you can see and touch on the outside. It includes the outer lips, called the labia majora, and the inner lips, called the labia minora. It also includes your clitoris, the clitoral hood, and the soft pad of tissue above your pubic bone, the pubic mound, where hair usually grows. All of this together makes up your vulva. I like to explain it this way. If your vulva is the frame, then your vagina is the picture inside the frame. The frame you can see, the picture is safely tucked behind it. You care for the frame gently, because it's exposed. You leave the picture untouched, because it's already protected by nature. When women try to treat the picture and the frame the same way, that's when problems begin. The reason this matters even more after 60 is that the skin of the vulva changes with age. As estrogen levels fall, the skin becomes thinner, less elastic, and more sensitive. What used to feel fine 20 years ago may now cause irritation, simply because that skin no longer has the same natural oils and moisture. So if you've ever wondered why your usual washing routine suddenly feels harsh, this is why. Your body isn't doing anything wrong, it's simply changing, and your care needs to change with it. The vagina, on the other hand, remains self-cleaning throughout your life. It doesn't need soap, it doesn't need rinsing, it doesn't even need plain water inside. When you interfere, you remove the very bacteria that are protecting you. But we'll talk more about that a little later. For now, just remember this: the vagina is self-cleaning, the vulva is not. One stays untouched, the other deserves gentle attention. So before we move into how to actually wash, I want you to pause and picture this difference clearly. Think of it every time you step into the shower. Because once you understand what you're washing and what you're not, everything else starts to fall into place. And in just a moment, I'll show you exactly how to give your vulva the care it needs without causing the irritation you've been trying so hard to avoid. Let me ask you something. Have you ever felt that no matter how much you wash, the irritation just keeps coming back? So the next day, you wash again. Maybe even twice. Maybe you scrub a little harder, thinking this time it will finally stay clean and fresh. At first it feels logical. After all, cleanliness has always meant washing more. But here's what so many women over 60 don't realize: that very habit is often the reason the irritation never leaves. When you wash too often or scrub too hard, you don't remove the problem, you remove your protection. The skin of the vulva isn't like the skin on your arms or legs. It's thinner, more delicate, and far easier to injure. Each time you scrub, even gently, you create tiny micro tears you can't see. Those little openings invite irritation, dryness, and sometimes infections that feel like burning or stinging, even when nothing is actually wrong inside, and it becomes a cycle. The more you wash, the drier and more sensitive you become. The drier you become, the more you feel the need to wash. It's a loop that never ends. And after 60, when your estrogen levels have naturally dropped, your skin simply doesn't recover the way it used to. What felt harmless years ago can now leave the tissue raw and inflamed. I've seen women convinced they had recurring UTIs, only to discover that their washing routine was the real culprit all along. So what's the answer? It isn't to stop washing altogether. It's to return to gentle, respectful care. Warm water, a mild, unscented cleanser, your clean hands instead of rough cloths or sponges. Nothing harsh, nothing scented, nothing that makes the skin sting afterward. Think softness, not scrubbing. And for those of you who struggle with dryness or that tight, uncomfortable feeling after cleansing, there are products designed to soothe rather than strip. If you'd like to know which kind I recommend, there's a link in the description where you can learn more about vaginal moisturizers that help maintain natural comfort after 60. These aren't perfumes or fancy lotions, they're gentle aids that support your body's own balance. Because when you treat your skin kindly, it begins to heal. The irritation softens, the itching fades, and that constant awareness of discomfort starts to disappear. And once that happens, you'll finally understand how much damage overwashing had been causing all along. But before you think the problem ends there, I need you to stay with me. Because the next mistake isn't about how often you wash, it's about where you wash. And when I explain what's really happening, you might realize that a habit you thought was completely harmless could actually be the most damaging one of all. Now that we've talked about overwashing on the outside, let's look at something that goes even deeper. And for many women, this one feels almost impossible to believe. It's a habit that seems perfectly reasonable at first. You step into the shower and you think, if washing the outside makes me clean, surely rinsing a little inside will make me cleaner. It sounds logical, even responsible, but it's one of the biggest mistakes I see, and it's quietly harming more women over 60 than you'd ever imagine. I want you to picture your vagina for a moment, not as something fragile or dirty, but as a powerful living system. Inside, the walls are lined with tiny glands that produce a natural fluid, what you know as discharge. That fluid isn't a sign of being unclean. It's your body's built-in cleanser. It moves gently through the vaginal canal, washing away dead cells, bacteria, and even traces of old menstrual blood. It's a constant, silent process, your body doing what it was designed to do. The vagina also keeps itself in perfect chemical balance. Its pH is naturally acidic, and that acidity protects you from harmful bacteria and infections. It's your own built-in defense system, and it works beautifully, until something interferes. When you rinse inside, even just with plain water, you upset that system. When you use soaps or douches, you don't just wash away bacteria, you wash away the good bacteria that your body depends on to stay healthy. And that's where the trouble begins. Once those healthy bacteria are gone, harmful ones grow faster. Suddenly you notice a change in odor, or thicker discharge, or itching that feels like an infection. You might go to the doctor, take a treatment, and feel better for a little while. But if you keep rinsing inside, it always comes back. It's not the infection that's recurring, it's the damage to your balance that keeps being repeated. I've seen this countless times in my own practice. A woman comes in, frustrated and tired, saying, "Doctor, I don't understand. I've done everything right. I wash every day." And when I ask what she means by wash, she tells me she lets the shower spray inside because it feels fresh. She thought she was protecting herself. But what she was really doing was removing the body's natural line of defense. Once she stopped, her symptoms disappeared, and for the first time in years, she finally felt normal again. It's important to remember this: the vagina doesn't need help to stay clean. It's one of the few organs in the body that takes care of itself automatically. You wouldn't scrub the inside of your eyes to keep them clear. You trust your tears to do the job. The vagina works the same way. Every rinse, every douche, every bit of soap inside interrupts something that was never meant to be disturbed. And this is especially true after 60. As estrogen levels fall, the vaginal lining becomes thinner and more sensitive. What once felt refreshing can now cause burning or tiny tears that leave you vulnerable to infection. You might not see them, but you feel them, that subtle stinging, that dryness, that lingering discomfort that never seems to go away. So here's what I want you to remember. Wash only what's on the outside, the vulva. That's where sweat, oil, and bacteria collect. The inside, leave it completely alone. The more you leave it to do its job, the healthier it will stay. And if you're wondering how to tell when something's truly wrong, when that odor or discharge means more than just imbalance, we'll talk about that soon. Because sometimes what feels like a hygiene issue is really your body trying to tell you something important. But before we go there, we need to look at a third mistake. One that feels harmless, even glamorous, but quietly works against everything your body is trying to do. It's the one that hides behind the promise of freshness. The one that's sitting right now on your bathroom shelf. And once you hear what it's really doing, you may never look at those products the same way again. Let's talk about something that seems harmless, even pleasant. The fresh scent, the promise of feminine confidence, the idea that cleanliness should smell like flowers. For many women, that message has been there since childhood. So when you notice a change in your natural scent, maybe a little stronger than before, maybe different after menopause, the instinct is to fix it, to reach for a spray, a powder, a wipe, or a deodorant that promises to make everything better. But here's the truth. These products don't protect you, they hide what's really going on, and in doing so, they make things worse. The scent you're trying to cover isn't your enemy, it's your body's messenger. That subtle odor is your vagina's way of telling you something has changed. Maybe your pH has shifted, maybe the good bacteria are struggling, maybe the skin has become too dry. When you layer perfume over that signal, you silence it, and that's when small problems quietly grow into bigger ones. Fragranced wipes, powders, and sprays can seem like instant relief. For a few hours, everything smells floral and fresh. But underneath, the delicate skin of your vulva is reacting. Those fragrances and alcohols strip away your natural oils, drying the tissue and creating tiny cracks you can't see. Through those cracks, bacteria and yeast can slip in, leading to irritation, itching, and even stronger odor than before. It's a cruel cycle. The more you try to hide it, the worse it becomes. And after 60, the risk multiplies. Postmenopausal skin is thinner and far less resilient. The outer lips, the labia majora, lose some of their natural padding, so every chemical, every trace of alcohol or perfume, hits more deeply than it once did. What might have caused a little redness in your 40s can now lead to days of soreness. You might notice burning during intimacy, or even after sitting too long. And yet many women never suspect that the culprit is their freshening routine. I've seen women walk into my office carrying entire collections of products, wipes for daily use, sprays for confidence, powders for moisture, and perfumed soaps. They truly believe they're doing the right thing, and who can blame them? Those ads are designed to make you feel like you need them to be clean. But you don't. Your body already knows what to do. It never needed perfume to smell healthy, it only needs balance. So here's what I recommend. If you ever feel tempted to freshen up, pause. Ask yourself what your body might actually be asking for. Is it dryness? Then it may need moisture. Is it odor? Then maybe your natural bacteria need a little help restoring balance. Instead of covering the problem, support your body's ability to correct it. If you'd like to explore gentle, fragrance-free options that help soothe irritation and maintain comfort naturally, I've included a link in the description with more information about vaginal moisturizers. These are not perfumes, not deodorants. They're products designed to work with your body, not against it. They help restore that soft, healthy balance that keeps your vulva comfortable and calm. Remember, your natural scent isn't something to be ashamed of. It's a sign that your body is alive, functioning, and self-regulating. When you stop fighting it, something beautiful happens. Your confidence returns. You stop worrying about every little change because you finally understand what's normal and what isn't. And now that you know how fragrances can quietly undo all your best intentions, I want you to stay with me. Because there's another mistake that hides in a completely different place, not in your bathroom, but in your closet. And it's one that most women never suspect could have anything to do with vaginal health at all. But once you understand it, you'll see how it ties everything together. This next mistake doesn't happen in your bathroom, it happens in your closet. And for many women it's so ordinary that it never even crosses their minds. You slip into your favorite trousers, your lace underwear, or maybe that comfortable pair of leggings you've worn for years. It feels normal, it feels harmless. But for the skin around your vulva, it can be the start of another cycle of irritation that you didn't realize was connected to this problem at all. The good news is that this mistake is one of the easiest to fix. Soft, breathable cotton allows airflow, absorbs moisture, and helps your skin stay calm and balanced. When you're at home, switch to looser, more comfortable clothing. And at night, give your body a chance to rest. Sleeping without underwear can make a bigger difference than you'd think. Synthetic fabrics like nylon, polyester, and lace may look beautiful, but they don't breathe. They trap heat and moisture against your body, creating the perfect environment for bacteria and yeast to multiply. Add to that a few hours of sitting, or a quick workout, or a walk on a warm day, and suddenly that trapped moisture becomes irritation, chafing, or another flare-up that feels like infection but isn't. And it isn't just the fabric, it's also the fit. Tight underwear and trousers press the delicate folds of the vulva together, making it harder for air to circulate. That friction can create redness, soreness, and over time the same micro-tears that overwashing causes. I often tell my patients, your skin needs to breathe just as much as your lungs do. If you'd like to improve this right now, you'll find a resource link in the description where I put my favorite brand. If you click on this link, you will be guided to a page where you can buy these underwear on Amazon. Now I will tell you the final and most important thing, but before we wrap up, I'd love to hear from you. Tell me in the comments where you're watching from and your age. I'm always amazed by how many incredible women join this conversation from all over the world, and if you'd like me to create a complete guide on vaginal and vulva care after 60, with all my tips, stories from women I've helped, and the gentle products I personally recommend, let me know in the comments too. Your feedback helps shape what I share next. Caring for yourself isn't just about what happens in the shower, it's about every decision you make afterward, from how you dry, to what you wear, to how you let your skin recover overnight. It all connects, and when you make small changes in each of those places, the difference adds up to lasting comfort. Every woman deserves to feel comfortable, fresh, and confident in her own body. And when you understand what to wash, what to leave alone, and even what to wear, you give your body exactly what it's been asking for all along. Care that's kind, simple, and made for you.